Hello and thanks for stopping by our website. My name is Dan Denai. I'm the Chief Operating Officer for Biote Medical. And I'm joined today by our Chief Medical Director and Founder, Dr. Gary Donovitz. Welcome.
Thanks.
You talk a lot about the alternative to bad medicine. Can you expand a little bit on what you mean by pellets being an alternative to bad medicine?
Well, really, pellets are an alternative to bad medicine because most physicians are now practicing disease management rather than health care. It's find a disease, get a medicine, then treat it. All the side effects come in, so when people treat diabetes, when they treat high blood pressure, heart disease, they're not preventing any of these diseases. They're just using drugs which have long-term side effects. Pellet therapy, hormone balance, hormone optimization for individuals can actually prevent a lot of these diseases. So if you can prevent the diseases, then people aren't on all these drugs when they get older.
Right, and the side effects that go along with that, I know it's always interesting to hear you talk about those side effects. Mention some of those things that you deal with.
Well, you know, when people are young, they have their babies and so forth, then they become depressed, irritable, anxious, lose their sex drive, start gaining weight. They get put on antidepressants. That certainly is not going to help. They're going to gain more weight. That's going to make their sex drive decrease. It's going to cause problems in their marriage, problems at their job. Hard to get people off antidepressants when their hormones are not balanced. So that's the first thing. Then people's cholesterol starts going up. Then they get put on cholesterol medications, which makes their muscle aches. They want to exercise, but their muscles ache, so they don't exercise. Plus, it makes them tired. So all the side effects from those drugs really are not helping things, and it's not the high cholesterol that's the problem. It's their hormones are not balanced. And as you get older, your cholesterol goes up. As your weight goes up, your cholesterol goes up. What if you could fix that problem where they could lose weight, have their cholesterol come down, then they wouldn't have to take those bad medicines? That's the alternative.
As far as looking at the entire blood panel that Biote looks at, talk to us a little bit about that, because I know there's a lot of people that are out there learning about hormone pellet therapy or hormone therapy in general, hormone balancing, but they don't seem to look at the entire picture. Talk to us a little bit about why Biote is different in that manner.
Well, a lot of people just look at their blood panels and look at the values on the right side, what the lab may call normal or the lab may call expected. The problem is those are not the normal values. There is no established normal values by age. So unless you know what those normals are, you really can't treat the patient. You really can't interpret the lab work. You can't individualize and you can't optimize. So what we do is we look at all of the blood in terms of thyroid, in terms of estrogen, in terms of testosterone. You have to balance everything because the symptoms really coexist. If you have low thyroid, you could present as though you had low testosterone. If you have low testosterone, could be the same as if you have low thyroid. So if you don't balance everything and look at everything, the problem is you really are not optimizing one's hormone therapy and then preventing diseases as they get older.
Talk to us a little bit about, we hear the statement, there's no studies out there regarding pellet therapy.
Yeah, you know, people always say there's no studies on testosterone or pellets or whatever. Pellet therapy has been around since 1939. It's used in 5 continents. There's studies on everything on pellet therapy, and whether it's just pellet therapy or testosterone or thyroid or whatever, the problem is there are studies to prove everything that we teach in terms of reducing heart disease. Testosterone is the one hormone that protects the heart, in addition to estrogen in women. In addition, testosterone and estrogen reduce the risk of Alzheimer's. There's multiple studies to show that. Why not protect the brain instead of having your family member develop some sort of disease for which there's very little treatment going forward? The other thing is testosterone, people who have low testosterone increase risk for prostate cancer and heart disease. So we can optimize those therapies and we can do it in a way so that they can prevent the diseases, and then you don't have to be on these medicines. But you have to know how to interpret the lab work, or how else are you going to individualize the therapy? That's what we teach at Biote.
Yeah, and it's interesting because we have doctors come to our trainings a lot, and you know they seem to be misguided in the way that they're interpreting labs. In other words, just what you just said, they're looking at it and they're saying, you know, the patient is in normal range. Normal is not optimal. And that's one of the things that I hear you talk about all the time. What is the difference between riding the roller coaster, as you call it, getting your hormones up, then coming down because you're on a pill or a patch or a shot? Talk to us about the benefits of the long-term having optimal levels.
Well, For years, people have been using synthetic hormones. Those synthetic hormones, usually you take by mouth, have all kinds of side effects. So your hormone levels are going up and down every day like a roller coaster. Women don't do well on a roller coaster ride with their hormones, I can assure you of that. So they have to take something every day, but it's still not working because they're up and down. Plus you have the risk of blood clots, heart attack, and stroke. That's also a real deterrent. So when people find that out, they quit taking their hormones. How are you going to protect the brain, the heart, the bones going forward? So that's a bit of an issue. If you use creams and patches, the absorption is variable. Again, you're on a roller coaster ride. You could have big spikes in your testosterone and your estrogen. Not good. So the side effects then outweigh the benefits. And again, they quit taking it. Injectables are the same. Big spikes, few good days, lots of bad days, certainly not balanced, certainly not optimized. If you don't optimize hormones, people won't stay on them. If you optimize them, minimize side effects, then people can stay on their hormones long term and prevent the diseases that we've been talking about.
And that's really what it really comes down to: balance, optimal levels, long term. If you have those three all put together and you're delivering them, and the only way that you're getting them is through pellet therapy, it makes sense that pellet therapy really is the most advanced way of balancing hormones.
So there's no question pellet therapy is the most advanced. If you want to be an advanced hormone doctor, someone who does hormone optimization, and you really want to get into it, pellet therapy makes the most sense with the least side effects. Pellet therapy sort of got a bad rap through the years because, one, people didn't know how to put them in. They watch videos on YouTube and think that that's a way to train. Or they'd go to a weekend class and go, well, I learned how to put pellets in a weekend. That's not really true. You can't learn it in just one weekend. It's sort of a process. So that's why we have a family at BioTE. We continually are doing webinars. We're continually training people. The continuing education is better than anybody else out there. So not only do you have liaisons in your office to help your staff, but you have me to help you on a day-to-day basis. No one else does that.
And the other thing that I think you've been very wise in establishing is a medical advisory board. Talk to us a little bit about how you determine that those are the greatest people or the best people to have to advise our other physicians.
Well, we like to pick people who have done a large number of pellets, pretty close to 1,000 pellets. Once you've done 1,000 patients out there, then you have a pretty good idea of what it takes to pellet the next patient. When the problems come up, you've seen those problems. You can't just do it on 20 patients or 50 patients or 100 patients. It's most important that you've seen the spectrum of things that can happen, not just with pellet therapy, but with hormone optimization. Then you can advise other doctors. So now we have a team where we can all advise each other and we can all collaborate. So we can not only look at what my side effects are, what your side effects are, how do we treat them? Maybe people have better ideas, which is the whole advantage of an advisory board, that we can collaborate going forward and actually make pellet therapy better for everybody.
Excellent, and I might point out that medical advisory board is made up of urologists, family practice, OB-GYNs, a lot of different areas of medicine that bring different aspects and maybe a little different viewpoint to treating different types of patients.
Well, that's right, because when you optimize hormones and you look long term, we are talking about things that involve nerves in the brain, heart, prostate, breast, bones. So we really need to have a collaborative effort with family practice, urology guys on the male side. What's new in urology? We want to know what's new with PSAs and prostates. We want to know from family practice what's new in the heart and how can we optimize hormones and actually reduce these medicines and actually prevent some of the diseases that people are going through. Less stents being put in, because why? We're keeping the coronaries open. Wouldn't that be better than having to have a surgical procedure to correct what you could have prevented? That's what we're really about. Correcting, really we're about preventive care, health care, not disease management.
Yeah, and I think that's really, if you summed it all down into what we're really trying to accomplish with BioTE Medical, it's getting to the root cause of the problem, not just treating the symptom. And you say that very well, looking at a health care model, not a sick care model.
Some of the benefits of becoming a BioTE certified practitioner include founded by physicians for physicians, superior pellet efficacy and sterility, a free comprehensive dosing website, no pellet inventory cost, no medical device cost, a dedicated physician liaison, marketing tools and videos, SEO and a national media buying service, patient financing, a physician retirement program, national lab contracts, ongoing training and support, volume discounts for medical supplies, complete nutraceutical line, and 100% money-back guarantee on training.
What type of physician are you looking to train today?
Well, we really like people that have large databases, that have lots of patients, because they have an already built-in referral pattern. So they can take that large database, apply what they learn at Biote to their own patients. Those patients will then refer other patients to them. So if you want to grow your practice, that's what Biote does. I've seen it time and time again. You pellet and treat your own patients, then all of a sudden you have this huge influx of new patients, not just for pellets, but for physicals and other problems. So it's one way you can grow your patient population, and in this environment with Obamacare and accountable care organizations, it's an awesome opportunity to increase your income really for very little work, and you're actually benefiting the patient. You don't have that opportunity with too many things these days.
It's a win-win. So you're helping your patients with something that they really desperately need and want. You're able to grow as a practitioner. You're also able to grow from a revenue standpoint because everyone is concerned, as you're talking about reimbursements and Obamacare and just the general changes in healthcare. So, what a fantastic opportunity for physicians out there. What would you say to a physician that's looking at this as a prospective opportunity for them?
Well, I think one, if you really want to get into what you went to become a doctor for, which is to really help people and do health care instead of disease management, Biote is your company. Two, Biote has managed to actually go out and help your whole office staff. Nobody else does that. We train the front office, we train the medical assistants, we train your nurses, we train you, we train your partners so that everybody in the office is actually benefiting from the same information that you're getting. Otherwise, you're just going to get the information and then you have to do all the training in your office, and who really has time for that? We give you everything from marketing materials, the pellets, the trocars, everything you need, loop videos for your waiting room. We've done all the marketing, we've done everything for you. Really all you have to do is just take care of your patients, and that's really what you went to school for anyway.
Right. Physicians nowadays seem like they're required and bombarded with this expectation of being these great business minds, and you really almost have to in order to stay in business. But with Biote and the Biote system, that really isn't the case, is it? You're really allowed to be able to practice medicine, just as you said.
Right, and we take care of the marketing and the business side so that you don't have to do that. We've made it very simple for you. I think it's so much better when you don't have to take an idea, a new technology, and try to apply it and then make all the mistakes. We've taken care of all of those for you, so it's actually pretty much a walkthrough for you. You come in, you get trained, we come back with you to your practice, and then you're up and running the next week. And it becomes profitable very quickly. Usually in the first month, you're profitable, you're up and running. After 50 patients, your practice grows exponentially. And you'll see from hormone optimization in your practice, once you reach that exponential level, your whole life changes, your whole practice changes.
Right, and really using it as a practice builder. Number one, you don't have a huge outlay. You're not going out and buying a $100,000 laser and then having to hopefully recoup that revenue over a long period of time. It's a very small investment in just a training package, really, is what you're doing. But then the other thing that we see with our patients, and I find it so interesting, and they come to us generally after the fact because at the very beginning they may have a few questions about how the revenue share works and how they're really going to make a lot of money with it. But I always tell them, don't discount all the other services that you provide right now as a practitioner, right? So you may be an OB-GYN, you may be a family practice person, but Biote, being an expert with Biote pellet therapy, really allows you to build other aspects of your practice, does it not?
It just allows you to build other aspects of your practice, but your whole practice then elevates because really patients start feeling better and you actually are doing something for the patients, and then you can get them off of these medicines. Those patients are so appreciative. Patients come into your office and now you have made a difference, not just in the patient, but in their marriage and in their job and in their life. You actually get their life back for them. These people will be lifelong patients for you. 97% of Biote patients stay with Biote and stay with pellet therapy. The reason is we have the right technology, we have the right dosing, we know how to teach it, and the side effects are minimal. You can't really get that with too many technologies these days because one, you don't get trained right, you see all these side effects, then you quit doing it, or worse, the patients quit doing it.
Right. And when that happens, you see a lot of times the patient will go out, if they're not treated correctly with pellet therapy, they go out into the marketplace and their friends and their relatives, and they talk about how bad pellet therapy is. And that's really not the case. The reality of it is pellet therapy is the best, but the only difference between medicine and poison is, as you always say, it's the dose. So if you don't have it dosed right, and you don't have the highest quality of product, then you're asking for trouble. And we see that a lot, unfortunately, in the marketplace.
Yeah, and what we do is we actually look at our pellets. We independently test those pellets against other people's pellets so we can make sure, one, we have the best product. Yes. We know we have the best dosing site because that dosing site has 30 years of experience with it, and it really tells you everything, how to treat the patient, what to look for, if you get side effects, how to adjust the dose. It's really a no-brainer, so you don't have to worry about how do I do this and how do I do that. Everything you learn is in the dosing site, and it'll be great as you go forward so you can review yourself what those rules are. We don't keep anything secret from you, and it's a real benefit to your patient. That way you keep your side effects low, and your continuation rate as well as your patient's is much higher.
Excellent. So really when we summarize this, we have the best training, the best quality of product with the pellets. We have the best modality from a standpoint of delivery method, and we're training people. We're effectively marketing the system for them. Hopefully this has answered some questions for you and given you a little insight into our founder and Chief Medical Director, Dr. Gary Donovitz. Thanks for stopping by and watching this video and learning a little bit more about Biote Medical. For more information, you may contact us at info@biotmedical.com or contact your physician liaison who sent you this link.